Now, what I really want to talk about is the bill that does away with the prohibition in Medicare physician-owned hospitals. And we've talked about this a lot in this committee. It is just fundamentally wrong that because of an academic degree that I have, I am not able to engage in a lawful practice in this country. And yet, you brought up in your testimony that consolidation in healthcare allows hospitals to own doctors. This is nuts. Hospitals can own doctors, but doctors can't own hospitals. Why is that okay? Let me just ask you, are you doing an analysis on, with this consolidation rulemaking that you're working on, or anything in the CMMI model development, are you looking at removal of this prohibition on physician-owned hospitals? Look, we talk about access, and particularly rural access. Physician-owned hospitals is a way to rapidly provide that access. And again, it's just fundamentally wrong that a hospital can own a doctor, but a doctor can't own a hospital. Thank you, Mr. Chairman. I'll yield back. I do not understand why a fundamentally different model could not be entertained, even as a demonstration project. I've already referenced earlier in the previous panel, hospital down in the Rio Grande Valley was doing an excellent job of providing service to uninsured and underinsured patients. They do that every day of the week down there. I mean, that is their business model. And I will just tell you, and I've shared with the committee before, a brilliant paper written in Health Affairs. Now, it's probably been 10 years ago. I may have been the one who wrote it. But look, as a physician, I want to go where my time is going to be maximized. And in a physician-owned hospital run operating room, I will just tell you, they're much more efficient. There is the pride of ownership. Doctors care about how their patients are taken care of. And again, I mean, you've heard me say it over and over and over today, and you all have emphasized as well the vertical integration that's occurring where hospitals are buying doctors, and yet doctors can't buy hospitals. I mean, it just fundamentally makes no sense. When an insurance company requires a hospital and a hospital requires a medical practice, do they require the doctors to use that hospital?
Depending on their insurance, my guess is yes.
Yes, the answer is yes. Thank you, Mr. Chairman. I'll yield back. You expect, but can you provide us the data? Can you provide us the models that you've used to make those assumptions? Because I think they're fundamentally wrong. And I would be happy to debate that with facts, but not what we expect will happen. I'd like to see actual numbers on that.